My name is Makisha Smith, and I will be delivering my educational video about otitis externa. What is swimmer's ear? Swimmer's ear, or otitis externa, is the inflammation or infection of the external auditory canal's soft tissues. Humidity, heat, air, or moisture can contribute to the start of otitis externa. This often occurs when water is trapped after swimming or minor trauma from cleaning improperly. Trauma may lead to a break in the skin. Swelling, redness, and pain will soon follow. Itching may lead to scratching, which causes more skin injury. The external auditory canal's environment then begins to change, and when the canal's warm and moist condition begins, pathogen growth may also begin. OE is also more common in people with eczema and asthma, and the infection can then spread to the pinna, tragus, and lymph nodes. Symptoms of otitis externa can include ear pain, itching in the ear, decreased or muffled hearing, clear or purulent ear drainage. Complication of otitis externa can include facial cellulitis, abscesses or pus-filled growths that can form around the infected area, malignant otitis externa, which is the infection that involves the external auditory canal and temporal bone and may spread to the skull base. And osteomyelitis may also result as the bone infection, which is rare but very serious and can be life-threatening. Treatment includes removal of debris, topical antimicrobial or steroid therapy, which may be a combination of antibiotic and corticosteroids, antifungal and corticosteroids, or a topical anesthetic to fight infection and reduce itching, swelling, and pain. A Pope earwig may need to be used, which is an expandable sponge if the ear canal is too swollen to allow entry of the eardrops. Pain control with over-the-counter pain medications such as ibuprofen or acetaminophen may be used. Avoidance or management of factors that may lead to infection may need to be addressed, such as chronic skin conditions such as psoriasis or dermatitis. And oral antibiotics may need to be used in the case of fevers, facial cellulitis, or swollen cervical lymph nodes. Possible adverse drug reactions of otic preparations include skin inflammation, superinfection with prolonged use, taste alteration, dizziness, vertigo, paresthesias, and ototoxicity. Monitoring treatment effectiveness. If severe inflammation requires a WIC for treatment, then reassessment should occur after 48 hours and again after treatment is completed. Symptoms are usually better in 3 days, but make sure treatment is continued for 7 to 10 days. You may take baths instead of showers and protect that ear from water. And avoidance of activity that may cause moisture buildup or trauma should be avoided for a few days until the infection is healed. As far as prevention, soft plugs to block the entry to the ear canal could be used. You're to make sure excess moisture is removed from the ear. You're to only use Q-tips for cleaning the grooves around the ear canal. To help drying, hold a hair dryer up to the ear for a few seconds. After swimming, running, or exercising, gently passing it near the ear canal. You could use 1 to 2 drops of rubbing alcohol to dry the ear after swimming. You should clean the rubberized tips of earbuds with alcohol swabs regularly. You could use a topical acetic acid as an ear spray preventative. And you should seek treatment for other chronic skin conditions. As far as health promotion, one of the main points should be to not try to remove earwax, as it is a self-cleaning mechanism. You shouldn't put any objects in the ear canal that are smaller than your elbow, as they may cause injury. You could ask your pool operator or use pool test strips to check disinfectant and pH levels to help lessen the spread of germs. You should also make sure that upper respiratory infections are treated promptly. And at any onset of any ear symptoms, you should contact your healthcare provider. So now, as far as demonstration of administration of eardrops, we are going to be practicing today with baby boy. Our first step would be to wash our hands really well and make sure they are all cleaned. Since we have baby boy, we would just lie him on his side, have him wrapped really well, and make sure that affected ear is up. If you have an older child, you could get them to lie on their side, or if they're a teenager or an adolescent, they could just sit straight up and have the affected ear up at the time, whichever is easier. We would then take our eardrops in between our hands and just make sure they're warm by rubbing it in between our hands for just a few minutes. We're going to examine baby outer ear, and if there's any clear drainage, we could just take a tissue and wipe it away, but make sure only to address the outer ear. I would then take my eardrops. I'm going to take the wrist of the hand that I'm using to instill the eardrops and place it on my baby's cheek. If my baby is less than 3 years old, I'm going to pull the pinna downward and backward to open the ear canal. If my child is older than 3 years old, I'm going to pull the pinna upward and backward to open the ear canal. I would then instill the correct amount of eardrops, whether it's 1 or 2 drops. I could rub the front skin gently to help the drug absorption into baby's ear. I will get him to continue to lay down for a minute or two. And if it's an older child and they won't really remain still, you can use a small cotton ball and put it into the ear to avoid leakage of the medication. After our medication administration is done, we'll put the top back on our bottle. We'll wash our hands really good, and then we'll note the time of the medication administration. And that is our demonstration with baby boy.